is adult ADHD truly a lifelong neurological condition, or is it a modern-day consequence of our lifestyle and exposure, such as toxic environment, poor diet, and chronic stress? In today's video, we'll explore what the research shows through a functional medicine lens and why so many adults are being diagnosed now more than ever. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So is adult ADHD real? ADHD in adults is very real, but maybe not always for the reasons we think. While classic ADHD is believed to stem from imbalances in brain chemicals like dopamine and norepinephrine, functional medicine asks, what's underneath that imbalance? We see skyrocketing diagnosis in people who never had these symptoms as kids, and that should make us pause and think. Could these attention, memory, and focus issues actually be symptoms of something deeper, like inflammation, nutrient deficiencies, gut-brain disruption, or environmental toxicity? So let's look at each of these factors. First, there's environmental toxins and brain function. Multiple studies link neurobehavioral symptoms, including inattention, impulsivity, and brain fog, to various environmental toxins. For example, heavy metals like lead and mercury, endocrine disrupting chemicals in plastics like BPA, pesticides such as organophosphates. They're known to impair dopamine pathways, and mold toxins, which can directly affect the nervous system. And these aren't some fringe ideas. A 2021 environmental research review showed that early life and ongoing toxin exposure could mimic or even cause ADHD-like symptoms in adults. The next and huge component of our life that matters is food, or more precisely, the food-focus connection. Diet matters a lot. Many adults with ADHD symptoms have underlying blood sugar dysregulation, food sensitivities, or nutrient imbalances. And some functional root causes include blood sugar spikes from ultra-processed foods that can lead to irritability and poor focus. Gluten and dairy sensitivities have been linked to cognitive and behavioral symptoms in susceptible, especially genetically susceptible individuals. Deficiencies in zinc, magnesium, iron, and omega-3s are common in people with ADHD, and these nutrients are crucial for neurotransmitter balance. Even artificial food dyes and preservatives banned in parts of Europe have been associated with hyperactivity. The next related factor is our gut health. And here's a powerful concept. Inflammation in the gut can lead to inflammation in the brain. And this is the gut-brain axis in action. If the gut barrier is compromised, something that we see a lot in our clinic and talk a lot about, that leaky gut, then inflammatory molecules can trigger neuroinflammation. This may show up as anxiety, poor memory, or ADHD-like symptoms. Research even suggests that certain gut microbes are responsible for producing neurotransmitters like GABA and serotonin. So when we see an adult struggling with focus, our first step isn't to mask the symptoms. It is to investigate why the brain isn't functioning optimally in the first place. So, is adult ADHD real? Yes, but in many cases, it may be a symptom, not the root cause. And that's exactly what functional medicine addresses. If you or someone you know struggles with attention, impulsivity, or mental fatigue, consider looking deeper. Your brain health may depend on what you're eating, what you're absorbing, and what you've been exposed to. If you enjoyed this video, please don't forget to like, share, and subscribe. And please leave a comment on this very acute and timely in our society issue. Thank you so much for watching. Until next time. Bye-bye.